9 things you need to know about home blood pressure cuffs. By the way, if you have a home blood pressure cuff, just drop it in the comments. Not the name of the cuff. I don't need the name of the cuff, but let me know. Do you have a home blood pressure cuff? I think it's probably a lot of you guys. First thing you should know is you need to make sure you get the right kind of cuff when you buy your blood pressure cuff. First point about that, I'm so dramatic. I'm so dramatic. I'm so amped up tonight, aren't I? The first thing in terms of buying the right cuff is it needs to be an arm cuff. Let me get my arm in there. It needs to be an arm cuff. This part of the arm, not a wrist cuff. Okay. Now, there are some people that are not able to use arm cuffs for different reasons. If that is you, you follow your doctor's guidance, your doctor's advice, etc. We also actually have thigh cuffs and other places we can check blood pressure. So that if that's you, you talk to your doctor and understand that that's going to be the case for some people. But for the majority of us, see this? My Popeye, look, my muscles. No? Okay. Anyway, you want an arm cuff. Those are more accurate. That is point number 1. Point number 2 is make sure your home blood pressure cuff is the right size. When I say the right size, what I'm talking about, let me get my arm back in here. You know, when you put the thing around and it goes right about here, if it feels excessively tight or if it's cutting off your circulation or something doesn't seem right, it may actually not be the right size. Now, you may not know what size you should get, and that's okay if you don't. That's where your friendly family doc comes in. I want you to bring that blood pressure cuff into us. But know that we know we say size matters. Well, size matters for blood pressure cuffs too. Yes, it matters. We want one that fits appropriately. If your cuff is too small in particular, it could read your blood pressure inaccurately. Okay, that's number 2. Number 3, let's talk about taking your blood pressure. Okay, number 3, when you go to take your blood pressure, first thing I want you to do is make sure you're taking your blood pressure at home at the same time roughly each day. It's going to be important. And make sure you're getting a number of readings. Not necessarily 5 or 10 readings at one time. What I'm saying is you want a range of readings that happen over time, because a few readings is going to be better than just one. Think about it this way, and even as a doctor, if somebody comes into me and they have high blood pressure, maybe I don't know them or don't know their history or they're new to me or whatever, I'm not going to just start them on high blood pressure medicine because of one number. Well, maybe there are some cases that I might, but you get what I'm trying to say, is that we want more information, more data. What if the person was nervous? What if, they forgot to take their blood pressure medication that morning? What have you? So think about that when you think about your home blood pressure cuff as well. Take your blood pressure at the same time each day, or at least try to. Also, try to get a series of numbers. Write them down or store them in the blood pressure cuff, okay? For you and for your doctor. That is number 3. Now, the next thing is when you go to take your blood pressure, y'all, this is not the time to have a cigarette before you take your blood pressure. I don't want you having a cigarette anyway, but we know many people smoke. And if you smoke, I do want to encourage you to quit. Why not put that little advertisement out there? If you're trying to quit, whoop, whoop, holla. But the reason why I say that is because things like smoking right before taking your blood pressure can actually cause your blood pressure to be higher than it would be normally. But that's also like if you drink caffeinated beverages right before, or alcoholic beverages right before. Also could be if you decide to run a mile right before you check your blood pressure. I don't want you doing that either. I want you to relax. If you get into a big fight or you get really, really, really upset, any of those things and more can affect your blood pressure in the acute state. So you want to sort of avoid, well, you definitely want to avoid smoking, alcohol, caffeine, all sorts of stuff that may cause your blood pressure to go higher, especially in the 30 minutes before your test. You want to be comfortable and resting comfortably, okay? The next point is to make sure that you're sitting quietly for about 5 minutes. You want your back supported and your feet flat on the floor, okay? So that's how you want to be. You want to be sitting comfortably, casually, just taking it all in. Your back supported, both feet on the floor when you take your blood pressure, okay? The next one is you want to make sure when you're taking your blood pressure, there's going to be instructions on your blood pressure cuff, okay? There's going to be instructions there, maybe on number 6. There's going to be instructions on your cuff. You want to follow that because you want to have your arm at the right level, usually and generally at the the level of your heart, okay? You also want to make sure that when you're wrapping the blood, I'm going to move out of the frame, when you're wrapping the blood pressure cuff thing around your arm, you want to do this on bare skin, okay? You don't want to wrap the blood pressure cuff on a shirt or a sweater or things like that. You want that to be on bare skin. That's very, very important. And this next thing is super important, guys. Super, super, super important. And this is what made me think about, oh my gosh, I need to talk to my peeps about home blood pressure cuffs. The next thing is bring in your home blood pressure cuff to your doctor, please. Bring your cuff into us, because what we can do, and what I then do, is we sort of check it against the one we have in our office. You know, the one that we have on the wall that we pump up, we listen, you know, we want to check your home blood pressure cuff against the one we have in our office that's hanging on the wall or whatever it is. That is very, very important because it helps us know if your blood pressure cuff is accurate or not. Now you might say, well, what do you mean accurate or not? Why? I mean, of course it's accurate. Well, not necessarily, guys. There's a number of home blood pressure cuffs that are actually inaccurate. There have been studies done on this. There have been articles written about this. And honestly, as a family doctor, I see it all the time. I see it all the time where home blood pressure cuffs are not accurate with what I'm getting in the office. And if that's the case, we want to know that. So if I'm sending you home to check your blood pressure with your home cuff, I want to know as your doctor that I've checked that cuff and that cuff is accurate, okay? So bring that cuff into your doctor's office so that they can check it. That's very, very important. Now, the last tip, guys, and probably this is one of the most important, I actually found this when I was doing research, and I'm actually going to start suggesting this to my own patients. There is, according to the American Heart Association, I love this idea, there is actually a list of validated home blood pressure monitors. It's actually the first sort of validated list to be developed, the first in the United States. It's been commissioned to meet the American Medical Association's criteria, and this list of sort of validated home blood pressure monitors is located at the website validatebp.org. Validatebp.org. I love this idea. Again, you know, I'm not sponsored by any of these people. I don't want you to think that I am. I'm just passing on the information because this is information I would give my own patients. These are really important things to keep in mind as you're looking for a home blood pressure monitor, as you're taking your blood pressure at home. Take that blood pressure cuff into your doctor to make sure it's checked and go over your numbers with them as well. And I would make sure if you haven't, maybe you've taken your blood pressure cuff into your doctor before, but you haven't done it in a while, you should at least do it once a year. So I think that hopefully will help you guys because I'm seeing a lot of inaccurate blood pressure cuffs. Guys, I hope this is really helpful about your blood pressure. Remember, also what's helpful is to eat a healthy diet, to make sure you're exercising, that you're controlling your other medical conditions like high blood pressure, like cholesterol, diabetes, etc., that you're getting your routine doctor checkups, you're following your doctor's advice. That's very, very important. Controlling your blood pressure and sort of staying on top of it is a really, really important thing for us to do. Guys, I love you. See you soon. Bye.